Okay guys, the first question is going to be derived from Evolve Resource for Verkol. It is Canadian Psychiatric Mental Health Nursing 2nd Canadian edition. The first question states, the quantitative study of the distribution of mental disorders in human populations called which of the following? A. Mortality, B. Prevalence, C. Epidemiology, D. Clinical epidemiology. The answer is C, guys. It's epidemiology, which is the quantitative study of distribution of mental disorders in human populations. Mortality, on the other hand, refers to death. Prevalence refers to the proportion of population with a mental disorder at a given time. Clinical epidemiology deals with what happens to people with illnesses who are seen by providers of care. Next question. Which statement best describes the DSM-5? A. It is a medical psychiatric assessment system. B. It is a compendium of treatment modalities. C. It offers a complete list of nursing diagnoses. D. It suggests common interventions for mental disorders. The answer is A, guys. It is a medical psychiatric assessment system. The DSM-5 is classification of mental disorders that include descriptions and criteria of diagnosis. It is published by the American Psychiatric Association, and its purpose was to provide clinicians, educators, and researchers with a common framework to understand and communicate about mental disorders. All right, next questions. Current information suggests that the most disabling mental disorder are the result of which of the following? Biological influences, psychological trauma, learned ways of behaving, or D, faulty patterns of early nurturance. The answer is A, biological influences. The biologically influenced illnesses include schizophrenia, bipolar disorder, major depression, and obsessive compulsive and panic disorders, post-traumatic stress disorder, and autism. Therefore, many, but not all of the most prevalent and disabling mental disorders have found to have strong biological influences. Psychological trauma, learned behaviors, and faulty patterns of nurturance, on the other hand, may contribute to some forms of mental illness, but they are not major factors in most disabling mental disorders. All right, guys, next video coming up.